I was 7 months along with my oldest son, and I had gestational diabetes. Then after my second son, I became full diabetic.
More patients are becoming obese, more patients are becoming diabetic, and more patients are becoming diabetic at earlier ages. Diabetes, obesity, hypertension, heart disease, these are all linked to lifestyle decisions that they've been making over the decades.
We did an early diabetic screen, 16 weeks.
The chronic care model is essentially a tool you can use to help rebuild your primary care site to better serve patients with chronic disease. And what we've tried to do is partner with them so that they are empowered to participate in the choices that we make to manage their diseases. And the reality is that when you do that, patients are more likely to follow through and do better.
Okay, Carol, you want to come on back? The self-management part of the model, I think, is very personal to me. The patients could set a goal at their provider visit, and then I would call them back and check in and see how they were doing with their action plan. It puts the care into their hands.
When I set the goals, I try harder to accomplish them, just so when I come back to see Dr. Sawyer, I can say, I did it. I do gardening and I plant vegetables, and that's also helping me with the exercise and also helping me to eat better. And I've done that, and I've lost quite a bit of weight.
We have redefined how the medical assistant interacts with the patient.
So let's get your vitals.
Before I see a patient, they see my medical assistant. What I found is if I could get all the lab work ahead of time, it freed up about 7 or 8 minutes of the visit for me to engage in conversation around lifestyle. It made the interaction much more meaningful to the patient and much more meaningful to me. And I started to see success with patients actually committing to goals that were important to them and then seeing results from those goals. They were actually losing weight, their A1Cs were dropping, they felt better, their emotional health seemed to improve. Sort of the backbone of the whole system is a registry to be able to provide proactive outreach care. Regular paper charts or electronic health records do not provide you the registry support that a database provides you, where you can go and you can query, who are my top 10 patients with the highest A1Cs? Give me all my patients who haven't been seen in 4 months.
She's gestational diabetic too, so we need her fasting blood sugars.
You need to be able to ask the database system those questions so that you can target the care. We've learned through different experiments with group visits that patients seem to do better when they're together receiving medical care. Polly Allen and Carol were the first mini group visit that we did about 1.5 years ago, and they've been coming consistently every 3 to 4 months together and receiving the majority of their care through this approach, and it really does work. I mean, their blood pressures, their A1Cs, their weights, they all indicate that they're doing better than they were compared to the way we were managing them before we started doing planned visits. And we've got about 3.5 years of data to show that.
Alan, any ideas about how to help Carol stay off the ice cream?
Polly and her dad, they're real awesome folks. I enjoy coming to the meeting with them and sharing the experiences that we go through. They encourage me and I encourage them, and when we reach goals or we accomplish something, we kind of pat each other on the back.
Remember, there's always a bright side to that, okay?
I think we're breaking new ground. Having these kind of support meetings, it helps other people know that they're not alone.
5 years ago, I was a pretty frustrated family doc trying to muddle through my day at seemingly no avail. It was very frustrating to try and help patients and then realize 3 or 4 months later that nothing had changed. Well, in the last 5 years, it's come about face. It makes my job much more satisfying when I can actually see outcomes and help patients make decisions that are important for them.
The doctors, the nurses, they became a family, and they treat each person completely different because of all their health problems, and a lot of it is the love that they show to everybody.
I hope I live to be a ripe old age. As long as I can get out there and kick around, I'm perfectly fine.
If you're not going to take your medication, you might not be around to see your kids grow up. And I didn't really believe that that was true. And now I'm finding out that it was true.